My first exposure with the Open Society Foundation was rather strange. It was somewhere around 2003 or 2004. At that time, I worked for Russian law enforcement, for Russian police, and it was a bit weird context. We had some sort of training center not far from Moscow, and at that time I was already trying to prepare myself for the peacekeeping operations. I found a booklet, and it was about Russia, and I was actually surprised to see that among regions where OSF either helped to work or somehow was engaged in working was my own region. I was originally from Saratov region, and there was a particular city, Balakova, and I read that it was so much affected by HIV. And then I had a brief discussion with my fellow police officers and kind of brought this because it was the topic which really surprised me. And they say, oh, don't really take this seriously. This Western NGOs and Open Society Foundation, that's Soros, and information from that source is not trustworthy. They probably work for CIA, so don't pay attention to them. And I didn't. And so then I went, instead of Kosovo, I went to West Africa. And that's where I first encountered HIV epidemic in full of its force. And then I kind of kept recalling what was in the OSF material I read. And then, guess what? Among the materials in that West African Republic where I was, there was Liberia, I found OSF materials as well. And then I came back from West Africa to Russia and joined the United Nations Office on Drugs and Crime as a lawyer, not as a police officer. And that's where I found many materials by OSF and started having many meetings with NGOs supported by OSF. By 2010, I was a lawyer with Moscow Bar. And I couldn't work as a lawyer. Basically, I couldn't do litigation, for example. I couldn't do any challenging, any work to challenge outdated or discriminatory laws and policies. So the legal network, it was a perfect organization to harbor me and allow me to do this work. On the one hand, to build capacity of key populations and non-governmental organizations. On the other hand, to start planning strategic litigation initiatives on all fronts, national level, international level, again, to give a boost to advocacy efforts, because at that time it was kind of the spinning wheel, the advocacy effort, especially in Russia. Government officials weren't ready for any meaningful cooperation. Civil society wasn't really trained to do anything more than just talking about the so-called humane drug policy, but whatever that would mean in legal terms. So it was about time to change the modus operandi and join more flexible organizations. So the legal network was one of those. The understanding of drug policy and why harm reduction, why opioid substitution therapy, why needle and syringe programs, why these programs are so important. Instead of just saying stop drugs, when people who are at risk of dying need other services, you start providing these services. Instead of moralizing, you start removing the most harmful things that actually make these people key populations, key and vulnerable populations. And now we are talking about decriminalization of drugs, right? It's all the same. It's not that easy for many people to get to the core of drug policy. It was easy to me. Somehow, I do remember my own healing curve when I first thought that opioid substitution therapy is really a madness. I thought, how would you even think about policy that would be so weird and sinister to give drugs to people addicted to drugs. You must be a crazy person. And I think it took just 2 days of reading to understand, well, it actually makes sense. But it was not so for those people, including from the human rights committees, many of whom would be professors, many of whom would be people from foreign affairs realm, and they would think big, the bigger picture. That's a kind of way of thinking, right? And to them, the deterrence is a big thing. Technically, there were two countries that embraced the policy of harm reduction and tried their best to implement it. Ukraine and Kyrgyzstan. Kyrgyzstan went all the way to bring all harm reduction interventions, including harm reduction in prisons. Ukraine didn't go that far, but opioid substitution treatment was at that time implemented in all oblasts of Ukraine, and Crimea was one of the most developed in terms of OST. There were more than 800 clients. And immediately, I do remember we were texting with folks from Russia. I do remember that everyone was absolutely sure that Russia would stop OST. If Russia is allowed to Crimea, and that was absolutely clear that Russia is going to influence Crimea, if Crimea is independent or semi-independent, or if Crimea joins Russia, doesn't matter. Russia is going to affect the policy, and the first thing Russia would do, for sure, they would shut down OST. So by June, mid-July, many people of the group of OST patients die, either there in Crimea and Ukraine when used illicit opioids, or in Russia after undergoing the so-called quote-unquote best treatments in the best clinics. They would overdose right there. I know a well-documented case where a person overdosed in St. Petersburg right after he went out from the drug dispensary, and it was a horrible experience, and the only thing he wanted to do is to use drugs, so he got overdosed. So many bad, horrible stories. Such comparatively mild story as 800 people undergoing through abrupt withdrawal, and some of them are dying. And by the way, who are these people? They're drug users. So it didn't really touch the nerve of the international community. I'd say that the story went unnoticed. On the good, positive end, we won several cases. One of the most important, I'd say, in terms of its consequences, is the case, again, surprise, surprise, against Russia, again in the European Court, but the case where a child was taken from mother. Child support services decided that a drug-using mother was not in a position to bring up children. There were two actually children. Took both children from her, and we succeeded in restoring her right. Brought both babies to her, and that was because of the European Court. The European Court ruled Russia was violating the right to respect for private and family life, and then Russian courts went all the way to restore her rights. So that was really something to be proud about. I'm talking about the European Court. All victories are partners. All failures are mine. That's my exercise, right? So I'm really very proud and happy when European Court, human rights treaty bodies, partners are doing something right. You actually feel that there's justice in this world.